Sexual dysfunction affects a large proportion of the population, but many tend to suffer in silence. But don't despair, because I'm joined in the studio by experts on this topic. We welcome Dr. Mark and Sister Elise. And over the next few weeks, we're going to be delving into sexual dysfunction and sexual health, making things a little bit easier for us all to understand. Mark and Elise, thank you so much for joining us. I think this is a very important discussion to be had. But let's start with a bit of context. When we talk sexual dysfunction, what are we actually discussing?
Michael, sexual dysfunction is anything that leads to an inability to want or to enjoy sexual activities, either in yourself or in your partner.
Okay.
And one of the things that I think people don't understand is that sexual dysfunction in one partner usually creates a sexual dysfunction in the other partner. There's a playoff against one another. And if one person is not functioning according to the other person, it creates friction and can create a disconnect. In other words, a sexual disconnect.
Right. And Sister Elise, what is the proportion of the population who are dealing with some level of sexual dysfunction? How common is it?
I think people don't realize how common it actually is. And if we want to look at male and female percentages, it's 43% in females and 31% in males, according to clinical studies.
Okay.
And it can affect all ages.
A lot of people, I think, assume that there's a mechanical problem. If you've got a sexual issue, it's a mechanical problem. What are the types that we are having to deal with beyond just the physical?
So broadly, there's 4 types. Your desire interest disorder, where you are not interested in having sexual relationships. There's a difference to being asexual. It's just, I know where I am, I know what I want, I'm just not interested in it. Can also be referred to as libido. And then you have your arousal disorder. Now, arousal disorder is, I'm interested in sex, so the libido is there, but you cannot get physically aroused.
Right.
And that's a big problem. We also have orgasmic disorders. Now, this is an interesting and a complicated one. For women, there's the anorgasmia, where they cannot achieve an orgasm. So, you know what's the goal behind this? For men, we start looking at either premature ejaculation or retarded ejaculation. And, it's embarrassing, both of them. So, I'm going to steer clear of them. And the last one, and the one that people don't really know about, is pain disorders, both for men and for women. It can be painful for certain men with certain conditions to have an erection or to achieve an orgasm. It's uncomfortable. But for women, this is probably, Elise, do you agree with me, one of the biggest problems that women have, especially as they get a little bit older?
Yeah, there's different conditions that is the cause of pain disorders in females as well.
I mean, I think a big question to ask here as well is the fact that sex is a big part of any good, strong relationship.
It's a function of a good relationship.
Absolutely. How destructive are these disorders to people's relationships?
As I said earlier, the biggest cause of sexual dysfunction in someone is sexual dysfunction in their partner. I always say, the first time that your erection fails, it's okay. I'm tired, it wasn't that interesting, it wasn't that good looking, blah, blah, blah. But when it starts happening on a regular basis, now it starts creating a psychological fear and aversion. We don't like being embarrassed in an intimate setting. So I don't like to let down my partner. I start feeling guilty. So I'm going to start avoiding it. And the moment that a man does that and he's in a steady relationship with a woman where he had a good sex life, alarm bell starts ringing in the partner. Why is this happening? Is it me? Is he getting sexual gratification from someone else? And now it starts spiraling into guilt on the partner's side, and eventually resentment, accusation. And you know what? This can break up relationships.
And if we can get something right today, is to let people know you can talk about it.
Absolutely.
It is a fundamental thing in a relationship, is to talk about your sex life.
Absolutely.
You know what, Michael? There's so many different causes that can lead to some form of sexual dysfunction. Broadly, we can divide them into two groups, physical and psychological. And when we look at the physical stuff, you know what, this can be anything from a chronic disease, things like diabetes, hypertension, cancer, kidney disease, liver disease, anemia, neurological conditions. And also the medication that we use for these conditions. The majority of my patients are on some kind of anxiolytic or antidepressant or mood stabilizer. So we're treating that condition, creating another condition which leads to further stress, anxiety in a relationship.
So at least communication around everything that's happening in our lives. How important is it that we realize the importance of speaking out about what we're actually feeling, because invariably there's some sort of a solution.
Absolutely. Go and look for help. If you don't have the confidence to speak to your partner about it, just get somebody that does these things and knows about these things to talk about. There's help out there, and that's very important.
I think one of the biggest problems with sexual dysfunction is that it's underdiagnosed. We know what the statistics say, 43% in women, 31% in men, but I can guarantee you that those numbers are far higher.
Because people are not
People do not talk about this. I think the first place where you start is speak to your partner, explain to your partner, listen, I'm starting to have difficulty, it's not you. I would like us to go and see someone and see what their options are, instead of trying to hide it from your partner, because it creates suspicion and eventually resentment and then sexual dysfunction.
Absolutely. Anyone who might want to get in touch to find out a little bit more, get some support, start a process, how can they find you?
You know what, the easiest is our social media and website, www.tclinic.com. And our contact number here in Johannesburg, 010-824-1393.
Wonderful. Well, Mark and Elise, thank you so much for joining us. I look forward to the rest of our discussions. I think it's going to be very interesting and hugely enlightening for a lot of people. So thanks for being with us.
Thanks,
Michael.